Good afternoon to you at 12:30. Brian Dust, how's it going on a Monday?
Doing good. We got to talk to Tyler Repking a little bit ago about his Bailey Zimmerman experience.
Oh, I bet that was fun.
That was cool.
It looked like a fantastic show.
It was.
I saw some of his videos that T-Rep put up there and about Speedy's car. You know, I never bought a car from Speedy's, but I know some people that do.
Know it.
And I was like, that's so cool. And that's really cool. But April Ritz, have you ever bought a car from Speedy's in Louisville?
I have not.
All right. That's the way it goes.
Yeah.
You were an Effingham girl. You didn't want to come down to Clay County, did you?
I didn't go to Clay County very much growing up, no.
It's okay. Hey, how you doing? Doing all right?
I'm doing great, yeah.
Welcome.
Good. Thank you. It's been a while since I've been on.
It's good to see. And you're on Facebook Live, and you got your pretty purple Pelvic Health and Wellness shirt on. That's pretty awesome. Did you somebody buy you that, or did you get that yourself?
Bought it myself.
I figured. You're the boss. So you go.
You know what you like.
Well, Dr. April in the house, we're going to talk about some pelvic health issues and what it's all about. And she said she gave me like 15 pages to read.
I have that too.
I was like, what are you trying to do? This isn't school.
You guys got a lot to learn.
You better get started.
Hey, school started.
That's
right.
Session.
How many kids you got in school?
We have 4 kids, but we are homeschooling. And so we have 2nd grade, kindergarten, preschool, and then an 18-month-old. Almost. He's actually only 14 months.
I feel sorry for that principal.
Yeah, my husband.
Try to line them up. All right. Anyway, you said focus on the yellow stuff. Let's start with the basics. Everybody out there, let's do a refresh, redo on this pelvic health. What is the pelvic floor? Tell us more.
So the pelvic floor is a group of muscles that connect. Males and females have pelvic floor muscles, connects from the tailbone up to the pubic bone and on our sitting bones on both sides. So it's kind of like a trampoline. It helps support our bladder and bowel, sexual function, core stability, pressure management, anything that goes on in that area, it's in control of. So it has a lot of main functions. And pelvic floor dysfunction is very, very, very common. More people think of in women, but it also affects men and children as well, which we see all of those in the clinic. My main focus today is for people to know that the pelvic floor, though, doesn't work in isolation. So what I mean by that, we are treating much more than just the pelvic floor muscles when you come into our clinic at Effingham Pelvic Health.
Just because pelvic floor is in your name doesn't mean that's all you focus on.
Correct.
That's good to know.
That's right. So what do you mean by that when you say, it's all connected? I get that part, but when you say you treat more than pelvic floor, what are you talking about?
So if somebody comes in with, say, urinary urgency, that doesn't mean it's coming from their pelvic floor muscles.
Oh, really?
Yep. So it could be coming from abdomen. It could be coming from the hips. So our hip muscles play a huge role in pelvic floor issues as well. But the other things we're looking at is we're trying to get to the root cause. Why is the issue going on, and what is the impact on the pelvic floor? So we are looking at our breathing and our diaphragm, which is way up in our upper abdomen.
Yeah, that's
up here.
A little ways away.
Yep. We're looking at the abdominal muscles, the low back, the hips, your posture, your feet and ankles even, the neck and jaw, as well as stress and the nervous system. So there's a lot that goes into this. So your muscles, your joints, your connective tissue, your breathing, your nervous system. And when I talk about nervous system, it's not just stress, but are we living in a constant state of go all the time and not letting our body relax? We're living more in fight and flight. Because the pelvic floor muscles are the first ones in our body. They're the muscles that will tighten up and protect us and guard us. So it might not be a specific pelvic floor issue. It's actually coming from our stress and how we're living day to day.
That makes sense.
Yes.
Hey, did everybody out there listening, when she said posture, did everybody sit up straight? Always do. You just mentioned it. Up you go. Like a soldier.
Yep. And if you have tailbone pain, don't slouch.
That's right.
Because if you slouch, it puts pressure on the tailbone. So sit upright.
Yeah. All right. Sit up good and you'll be fine.
Right.
Well, maybe you'll.
No, you need to come see us.
Okay. I need. You talk about today. It's the jaw. A lot of jaw problems. Can't get much further from the pelvic floor up there around your head and stuff.
Yeah.
TMJ, I've heard about that, or jaw tension.
Temporomandibular joints.
How is that in there? That makes no sense to me.
Yes. So
you went to school to do this.
This does surprise a lot of people. If you think of it, though, when you have jaw pain, what most people find with jaw pain is they unintentionally are clenching at their jaw. So this also goes with stress. And so there's been, there's been studies
Greg
that show some deep breathing. But if you clench your jaw, or if you sleep with a tight jaw, if you catch yourself kind of shrugging your shoulders when you start to get stressed, if you hold your breath or hold your abdomen in all the time, those are ways our body's telling us that we're holding stress in our body. So we see a lot of patients in the clinic with jaw pain. We just had a new evaluation come in last week, and she's like, on our intake form we put jaw pain because to us it makes sense, it goes together, but to patients it doesn't.
Yeah, it's like, I got it, but what's the deal?
Yeah,
right?
why are you asking me about my jaw pain? We're like, oh, because they go together more than you even know.
It's crazy to think about.
Yeah, so we actually treat TMJ issues in the clinic. Physical therapy is for that, so we can do jaw mobilizations, we can do dry needling into the jaw, into the masseter muscle here. So dentists and people that work in dental offices, if you're listening, we do more than pelvic floor. We can treat jaw issues as well.
That is very interesting.
So we got to get our jaw to relax to also help with our pelvic floor relaxing.
Relax, guy.
You said something related to that just a second ago. I got to step back and ask you, did you say something about sleeping with a tight jaw?
Yeah, so some people grind their teeth at night and they have TMJ issues. So this is where working with a dentist who like really knows a lot of the TMJ issues and like wearing sometimes night guards can help.
Yeah.
But then during the day, being intentional of how you're holding your mouth and how you're holding your tongue. Not like that. Don't stick your tongue out at me.
Talk to the principal.
But yeah, like how you're holding your mouth. We go over exercises. We go over exercises on getting your mouth muscles stronger too. It's not just Kegels. It's not just pelvic floor.
Yeah.
So, are you kind of implying then that someone could, come in, talk to you for pelvic pain stuff, but you might say, well, you got this thing with your jaw or neck and that kind of stuff.
Yeah, so we will often work on neck relaxation, vagus nervous system, which is the nervous system, which causes more tension in our body. A lot of that is around the jaw and neck as well. So we'll do a lot of hands-on manual work around the face because it plays a role in getting our body to relax, which in turn helps our pelvic floor muscles relax if you're having pelvic pain, tension, urgency, things like that.
Wow.
And Brian, you know what she's reminding me of?
No.
That guy, he says, I'm not saying it's the aliens, but it's the aliens. You're that guy, but I'm not saying it's the pelvic floor, but it's pelvic floor.
So, and we also say too, we're not saying just because you have TMJ pain, that's causing your pelvic floor issues, or you have pelvic floor pain, it's causing your jaw issues, but they do go together.
Yes, they do. That's very interesting. So could someone come to you for pelvic pain and actually end up working on all that stuff and your neck? I mean, you're talking about the jaw, but you're like, I got a neck issue today, but I think it was just because I was staring at a computer screen for 3 hours.
That plays a role. Yeah. So a patient this morning, we worked on feet. So it's pelvic floor issues.
We
worked on the feet and we worked on neck.
Well, that's as far apart as they could possibly.
Yep. And we did some dry needling for upper trap for tension, a lot of pain, referred pain through that region. So relaxing all of that, we have to work on jaw clenching, proper breathing, relaxing our body. So we always say too, like a tight pelvic floor doesn't mean that it's strong. So you guys know this. You should just be doing Kegels.
Yeah.
Okay.
Yep.
But we can't just work directly on the pelvic floor. We got to figure out what's playing a role in that. So working on the neck issues, working on the jaw. And if we're going to talk about feet, that plays a role too.
That's crazy.
So your feet, when we're up moving, walking, running, exercising, carrying kids, carrying boxes, whatever it may be, all pressure goes through your feet up your body. Okay. So think about somebody who has significant flat feet or overpronation, prior ankle injuries, Achilles tendonitis, anything like that is going to cause an above chain reaction.
Okay.
So if we're limping on one foot or favoring one side than the other, it's going to cause more favoring of one hip versus the other, which then is going to affect the pelvic floor.
Absolutely.
So for example, the one this morning, we're working on an ankle sprain as well as chronic Achilles tendonitis. And this person was told that they might have to have surgery for their foot for plantar fasciitis issues too. And I was like, okay.
Slow down.
Yeah. Have you done any therapy for your foot? Let's look at it. And there's just a lot of muscle weakness, tension, all of that. So pelvic floor patient, but we're working on reducing tension in the upper trap, releasing feet issues, working on strengthening there, range of motion, all of it. So
my goodness.
Wow,
it's
that
a
is
lot.
It is a lot.
People come in and they think they're just going to get pelvic floor. Not in our clinic.
Head to toe, baby. It's very interesting.
And you mentioned, I mean, I don't want to lead the listeners down the wrong path, but you got to ask a question. Some people just heard what you're saying, and they're like, huh, so are you kind of hinting that you fix somebody's foot, ankle, leg problem? There goes the pelvic floor issue solved?
Potentially.
Okay.
Potentially.
Really?
It depends on the root cause.
Uh-huh.
Yeah.
And often what we're finding with our patients, a lot of our patients are very, very complex patients. And there's multiple root factors contributing into the symptom that they're experiencing. So just fixing the foot and only addressing that is probably not going to 100% solve their pelvic floor issues.
Okay.
We've got to look at the breath. We've got to look at the pelvic floor muscles. We've got to look at the core, the hips, the pelvic alignment, all of that. But if we don't fix the foot, the patient might just get 75% better, and that last 25% isn't addressed because we're not fixing the foot.
Got to fix it all.
Yeah, put it all together.
You can't have bad tires on a car. It's not good.
That's right.
All right. So you're telling me I'm a wreck from head to toe. I've got to get somebody
No
straightened
kidding.
out here.
Yes.
Can you give us an example? What's it look like when you go in and do the whole body pelvic PT experience? What's this all about?
Yeah, so we do a 2-hour evaluation because it is very complex. We don't just segment it out into your pelvic floor. Like if you go to a urologist, they're going to ask you about your bladder issues, but they're probably not going to ask you about your reproductive health, gynecological, your GI, your pooping, all that. We ask all those questions because it all goes together. So let's say if somebody comes to us for pelvic pain, and what we find out is that this lady's also tension in her jaw all the time, clenching her jaw. Her neck and shoulders are tense. She knows she holds her stress up here. She catches herself holding her breath. We look at her. We realize her rib cage is not expanding and opening with breathing. Her hips are super tight as well as weak. And she had an old ankle injury from 10 years ago that she never fully rehabbed.
Oh, no.
So that tells us we get all that within a first 2-hour evaluation.
Sure.
So that gets us going, like we're detectives and putting it all together. Like all of these things could be contributing to her pelvic pain. So if we would just look at pelvic floor only, we'd be missing the neck tension, the clenching the jaw, the foot injury from 10 years ago. So we have to really listen to patients and put it all together. So for them, we'd be working on breathing, getting those ribs to open, abdominal coordination, the hip strength, the hip flexibility, looking at the ankle. Is it weakness? Is it an Achilles injury? Is it a tightness issue going on there? And then with all of this, what's her nervous system level like too?
Sure.
We do a screen on patients to see where their nervous system is, and it tells us a lot about how their body is just functioning and where we need to start with them. Does a patient feel safe in their own body, or are they just protecting and holding tight everywhere because they have so many things going on around them in life where they can't manage it all, and they just are
Too
holding
much.
too much.
Yeah.
And a lot of our patients have that going
I'll be
on
darned.
too.
Well, that's kind of the last thing I want to ask you, and that's, hey, the listeners are hearing this, and it kind of makes sense. You've got connections with this and that and the services you offer. So what are they, like listeners right now, like what should they kind of keep an eye out for saying, hey, maybe this needs evaluated?
Yeah, so I'm going to go through several symptoms here real quick, but urinary leakage, bladder urgency or frequency, difficulty emptying your bladder or bowels, constipation or straining, pelvic heaviness, pressure or bulging, or prolapse, pelvic pain, pain with intercourse, tailbone pain, any pain during pregnancy or postpartum. Those are all things that we treat in our clinic on a daily basis. And one thing that I want listeners, that people that are listening to know that they can start doing today for their pelvic health is I don't want you to think of pelvic health and Kegels. I don't want you to automatically be like, oh, I have some of those issues. I need to start doing Kegels and start strengthening.
Right.
Often people need to learn how to relax those pelvic floor muscles because all the things we talked about today. So kind of, as you're listening, ask yourself these questions. Am I constantly clenching my jaw? Do I have pain popping in my jaw? Am I holding my breath at times? Do I feel like I hold in my abs? Do I suck in my abs all day? Do I feel like I'm constantly carrying tension in my body? Whether that is your jaw, your neck, your pelvic floor, low back, okay? If you just sit down and take a deep breath, where does your breath go? Does it go up into your shoulders and upper chest? Or does it actually go into your rib cage? And your belly gently opens. A lot of people holding stress will breathe up into their upper chest.
All right there.
Yep, upper chest and up into their shoulders. like that rather than getting those ribs and belly to open. And then all of that connects with the pelvic floor. So if you're dealing with constipation or pain or urgency, neck tension, like if any of this like spoke to you, you probably need a pelvic floor therapist that's looking at the entire body on your team. And because the way our clinic practices, we don't have to have a referral and we don't have to just treat one body part at a time. When I was at a hospital-based program, I could only focus on your pelvic floor.
Sure.
I was not allowed to look at your neck. I was not allowed to look at your...
Because they had other people to do that, yeah.
Well, yeah, and it's only one diagnosis for insurance. So we can treat neck, jaw, low back, hip, pelvic floor all in one setting, and that's how it should be.
Yeah.
So, yeah. So if anything stood out from today's like conversation, or if you want to know more information, you can easily reach out to our office.
Sure.
We'd be more than glad to talk to you about it.
Breathe deep.
Yeah.
The gathering gloom. That's Moody Blues. All right. Very good. This is very interesting.
No
and
kidding.
I love this. We learned a lot today.
Yeah.
We learned a
Good.
little something today, in which we always do when you come in. If somebody wants to call you real quick and set up an appointment because they want to do it right this minute because I've got every one of those symptoms, what's that phone number?
Yes, our number is 217-705-5077. No referral needed. Just give us a call. We'll tell you how our clinic works. We are booking out, though, a little bit, so be patient with us. And if you know any physical therapists that are interested in pelvic health, we are hiring.
All right.
Okay.
Let's get the biggest and the best for you. That's for sure.
Yeah.
You guys do an awesome job. Always a pleasure. Take it easy, and we'll see you next time, okay?
Thank you.
BD, talk to you on the drive home tonight.